Good day, everyone. I am Dr. Rodolfo Nonato, an ear, nose, and throat and head and neck surgeon. And today, I was invited by my good friend Token Lizares to talk to you something that is relevant nowadays that concerns my specialty. So I chose two topics. One is about COVID vaccinations of the elderly and of the senior population of our province. And number two is dengue fever that is creating a lot of problems and havoc in the province. I am a little bit surprised when I meet patients in the clinic and tells me that they have not been vaccinated yet. And I'm talking about people who are in their seniors, 60 and above, and the elderly, more so in their 70s or 80s. And they tell me that they are afraid of subjecting themselves to COVID vaccinations because of the complications that they hear in their barangay or among their friends and in the social media. And they believe all this, but I keep on telling them that what more are you afraid of? You have passed this earth for so many years. You've gone through many immunization, mumps, measles, rubella, tetanus, polio, flu vaccine, anti-rabies. Nothing happened, and now the COVID is causing a lot of problems in the entire world. And the only protections we have is actually this COVID vaccination. Well, I hope that the elderly will realize the value of having this kind of vaccinations among them. This will actually be one way of reaching the herd immunity so that the virus will just fade away, because the virus will keep on looking for a patient or for a host in order to survive. If you are vaccinated, chances are the virus will just die inside your body because you're immunized and there is no more chance of it jumping to another patient. And if ever it jumps to another patient and contaminates that patient, but if he is still fully vaccinated, still there is a chance that that virus will not anymore cause any contaminations to others. So hopefully our elderly will realize the value of this vaccination. Then we go to dengue. Dengue sometimes is difficult to recognize, more so if it has a concomitant upper respiratory tract infection, and it might even be mistaken for COVID. But the classical COVID does not have any upper respiratory tract infection. It will manifest as high fever, muscle pain, body pain, rash, conjunctivitis or redness of the eye, headache, and sometimes in the severe form will cause bleeding. So the most important here is you have to be vigilant. Patients having this kind of manifestation should seek help. And usually these patients will feel really bad. They lost their appetite, and most of the time they don't eat, and they lose a lot of fluid. So people who have these manifestations will have to seek medical help and might need some hydration. So be vigilant in your barangay. The moment you have high-grade fever, don't underestimate it. You have to seek medical help. So that's all, folks. I hope you gain some knowledge in what I have given you. Thank you, Token, for giving me this opportunity. Bye-bye, take care, and stay safe.